Imagine trying to read your favorite book, but your eyes feel like sandpaper, making every word a challenge. Or picture stepping outside, only for your eyes to water uncontrollably from the slightest breeze. This is what living with dry eye can feel like, a constant struggle just to see comfortably. Dry eye isn't just an inconvenience, it's a daily challenge. The pain, the blurred vision, the light sensitivity. For millions, it's more than an annoying symptom, it's a serious barrier to everyday life. So, what if I told you there's a way to help repair and soothe the eye surface, using something as natural and nurturing as the body itself? This is where amniotic membranes come in. Section 1. What is dry eye, and why does it happen? Dry eye happens when your eyes just aren't getting the moisture they need. Normally, your eyes produce a steady supply of tears that lubricate, protect, and nourish. But when this system falters, your eyes suffer, leading to uncomfortable symptoms like blurry vision, especially after reading or screen time, burning, stinging, or gritty sensations, redness, light sensitivity, and eye fatigue. Sometimes it's just because you're aging, and tear production slows down naturally. Other times, it could be due to health conditions, medication side effects, or environmental factors. For many, over-the-counter drops and treatments just don't cut it. So where does an amniotic membrane come into play? Section 2. What is an amniotic membrane, and how does it help? The amniotic membrane is the innermost layer of the placenta, the same structure that nourishes and protects a developing baby. But it has a hidden talent. This membrane is rich in natural healing agents like stem cells and growth factors that encourage cellular growth and repair. Doctors have started using amniotic membranes in eye care to treat conditions like dry eye, particularly when other treatments have failed. Here's how it works. The membrane contains layers of collagen, similar to what's found in the eye, which can help rebuild damaged tissue. Its unique structure also includes hyaluronic acid and cytokines, which are key in reducing inflammation. Using a small, flexible ring, the amniotic membrane is placed on top of the eye. The membrane acts as a kind of soothing bandage that not only protects but also actively heals the eye surface. Section 3. Types of amniotic membranes and how they are used. There are two main types of amniotic membranes used for eye treatments: dehydrated and cryopreserved. Here's a quick breakdown. Dehydrated amniotic membranes. These can be stored at room temperature, making them easy to handle and transport. When it's time to apply, they're rehydrated with a saline solution to prepare them for use. Cryopreserved amniotic membranes. These require freezing to keep their healing properties intact, so they're a bit more difficult and expensive to store. However, they're attached to a carrier paper, which makes it easy to cut them to the perfect size, and they don't need rehydration before use. Both types work in similar ways to treat eye conditions, and both have shown significant benefits in helping the eye heal from dry eye disease, corneal ulcers, and even after certain surgeries. Section 4. How does an amniotic membrane treat dry eye? When placed on the eye, the amniotic membrane acts as a protective, healing layer, reducing inflammation and promoting growth of new, healthy cells. The idea is simple yet effective: protect, heal, and repair. How does it work? Protection. The membrane shields the eye, keeping it moist and preventing further damage. Healing. With its rich nutrients, it accelerates the repair of damaged tissue. Anti-inflammatory properties. It has natural compounds that reduce swelling and irritation. This natural solution is often delivered in an in-office procedure, where doctors can place it directly on the eye surface. They'll often use a flexible ring to keep the membrane in place, sometimes with a bandage contact lens for extra stability. Once the membrane is secure, it remains on the eye for a few days while it's absorbed. During this time, patients are usually advised to keep the eye shut to help with the absorption and healing process. Section 5. Beyond dry eye. Other conditions helped by amniotic membranes. While dry eye is a common reason for using amniotic membranes, these natural wonders have potential in other eye conditions as well, including corneal ulcers, painful sores that affect the cornea; bullous keratopathy, blister-like swellings on the cornea; pterygium, raised growths on the eye that can impair vision; neurotrophic keratitis, a degenerative condition affecting corneal health. Even in cases of chemical burns or thermal injuries, amniotic membranes have shown impressive results, helping damaged eye tissue heal with minimal scarring. Section 6. The science of amniotic membranes, layers of healing. Let's break down how each layer of the amniotic membrane contributes to healing. 1. Epithelium. The outermost layer helps form a barrier against further damage. 2. Basement membrane, rich in collagen. This layer supports new cell growth, acting much like the eye's own corneal tissue. 3. Stroma. This innermost layer contains compounds that promote moisture retention and reduce inflammation. In fact, studies have shown that these natural components significantly improve symptoms in people with moderate to severe dry eye disease, giving them much-needed relief. Section 7. Are there risks? What should you consider? Amniotic membrane grafts are generally very safe, with minimal side effects. However, as with any medical procedure, there are a few potential risks. Loss of the membrane. This can happen if it isn't secured correctly. Infection. Though rare, contamination can lead to infections like keratitis. But rest assured, all membranes are screened and treated with antibiotics to minimize this risk. If you're considering an amniotic membrane graft, consult an eye specialist to discuss whether it's a good fit for your specific needs. Section 8. The future of amniotic membranes. Eye drops and beyond. Research is ongoing, but amniotic membranes might soon be available in eye drop form, offering a more convenient and accessible way to harness their healing power. Imagine relief that you can carry with you wherever you go, bringing healing straight to your eyes in just a few drops. Conclusion: dry eye doesn't have to be a life sentence. Thanks to the natural healing properties of amniotic membranes, there's now a powerful tool that can help restore comfort and clarity to tired, damaged eyes. This treatment option, while rooted in the power of the human body itself, represents a step forward in modern medicine. If you or someone you know is struggling with dry eye, take the first step today. Talk to a healthcare professional and discover if an amniotic membrane graft could be the answer. After all, our eyes are our windows to the world, and it's time we treated them with the care they deserve.